Thanks for joining us for National Focus. I'm Shaakira, Pierre. Coming up, DOWASCO develops pilot water safety plan, UK's Caribbean Infrastructure Fund meant to deepen ties with the region, and PAHO presents plan of action for school nutrition policy. Stay with us for details of these and other stories after this.
A picture is worth 1,000 words. Got it? Taking care of us can be so easy.
Take good care of the children.
Thanks for staying with us. In 2015, United Kingdom Prime Minister David Cameron announced that his government would invest £300 million into new infrastructure in 9 Caribbean islands. For this, United Kingdom Caribbean Infrastructure Partnership Fund, UKCIF, about £25 million allotted to Dominica have been earmarked for the upgrade of the Lubia to Bagatelle Road. On Tuesday, British Parliamentary Under Secretary of State of International Development, Baroness Sandeep Verma, accompanied by the MP for the Granby constituency, Justina Charles, and Minister for Public Works, Miriam Blanchard, visited the site. Honourable Charles expressed elation over the impending upgrades from which her constituents will benefit.
I am happy at least the British government has come to the aid of Dominica and has decided to make available that grant of £25 million for the road, and I think driving through, they have a better appreciation of the amount of work that has to be done, because we know we have quite a bit of cliff that we have to be paying attention to, where we normally have slides on a very regular basis when it rains, and we have also weakening of some of our road failures, and so we also have some of the precipices that we need to do some guardrails and to put other protective measures in place to make sure that the road users can drive on what can be considered safer road. So I think it is going to bring, while we are not going to start immediately, because before the actual work begins, it takes some time where you have to do all your feasibility studies, you have to do all your bidding, all your procurement procedures, and so while it will take a little time, but at least that is already, that we know that it is in the making.
At the time the fund was announced, the UK Prime Minister indicated that this initiative was focused on reinvigorating the relationship between the UK and the Caribbean countries. When the Baroness met with Honourable Prime Minister Dr. Roosevelt Skerrit on Tuesday, he expressed a desire for further deepening of ties between the UK government and CARICOM.
I believe that the relationship between Dominica and the United Kingdom is very solid, and we are always more than prepared to work with the British government on bilateral issues, multilateral issues. We have suggested to the British government some ways in which we can enhance that coordination, and that we need to ensure that there is sufficient political exchange between the governments, because there are some things which only politicians can deal with or speak about. And therefore it's important for us to maintain the political exchanges, so that the relationship between the Caribbean community and the UK government, UK people, can certainly be strengthened and deepened.
In her discourse with the Dominica leader, Baroness Verma spoke of the UK Prime Minister's interest in the strengthening of relationships on both sides.
The Prime Minister was very keen to make sure that not only were we fully re-engaged back with the Caribbean, but the Caribbean was fully re-engaged back with the UK, and I think it's really that two-way relationship that he's very keen to build on. The infrastructure fund, we're actually going to go and see the road today, later on in the afternoon, but that's just part, I think, of the wider engagement that you rightly have alluded to, and I think part of it, Prime Minister, is about looking at the economic growth story that goes beyond the road.
Government has made a public request for expressions of interest in consultancies services for the completion of a feasibility study for the project. The objective of the consultancy is to assist in developing a technically and economically feasible program of works for the rehabilitation of the road. The Caribbean Development Bank, CDB, and the Department for International Development, DFID, have partnered in the implementation of the UK Caribbean infrastructure. Water safety stakeholders are learning to create a water safety plan with the financial aid of the World Health Organization. Water safety planning is a WHO approach to reducing the risks associated with poor potable water quality by preventative action from the catchment to the consumer. The stakeholders participating in the workshop represent the Ministry of Health and Agriculture, the Forestries and Fisheries Division, Disaster Risk Management, and the Bureau of Standards, among others. The workshop is being executed by CAFA, the Caribbean Public Health Agency, on invitation by Water Safety Champions DOWASCO. Bernard Etinoff is General Manager of DOWASCO.
Governments have a mandate to provide a clean, potable drinking water to our citizens, and we are very grateful for the assistance that we are getting this morning from CAFA and the Environmental Health and Sustainable Development Department of CAFA to put this plan together. It is something that will seek to govern how we manage our water resources from the catchment areas. And when I speak of catchment areas, I'm not just talking about the intakes across the rivers, but I'm talking about the wider catchment area, the several acres of lands around those rivers, how we manage those things to ensure that we provide water that is suitable for consumption to our people, thus avoiding the unnecessary health risks and ensuring that our people are on a sustainable growth path to development.
CAFA, through its Environmental Health and Sustainable Development Department, has supported the implementation of water safety planning in a few selected Caribbean countries and aims to establish at least one system in each member state. Lyndon Robertson works with CAFA in that mission.
Water safety planning has been proposed by the World Health Organization as a critical tool to reduce risk to human health as a result of contaminated water supplies. It is based on a hazard analysis critical control points approach, which is called a HACCP approach, in that the water supplies are managed from the watershed, the hinterland, to the final consumer. This will involve working with a number of partner agencies, most of which are represented here. To conduct field visits, we would be doing literature reviews, and most importantly, in-depth assessment of all components of the water supply system. Working closely and networking with all partners will realize a holistic and participatory approach to the development of the water safety plan.
Each water area throughout each country should have its own water safety planning system. Initially, the project will guide stakeholders in the establishment of one pilot, which will serve as a model for replication at other sites. They will first establish teams to steer the project and then describe the water system in terms of its assets and limitations. The group will then verify the hazards to the system, for example, personnel challenges. The fourth step will be to measure or reassess and then prioritize the hazards and risks to the system. Following this, they will develop, implement, or upgrade the water safety plan. The group will set up a defined monitoring system and then verify the effectiveness of the water safety plan. The eighth step is to develop management procedures, following which they will also develop supporting programs as necessary. That could mean personnel training, communication, protocol, and/or others. They will set up periodic reviews, and the final step is to revise the entire plan after any incident. On the second and final day of the workshop, the group will visit the site selected for the pilot water safety planning system. The Ministries of Health and Education have enlisted the assistance of a Pan-American Health Organization's PAHO nutrition advisor, Dr. Audrey Morris, to complete the draft consultation for Dominica's school nutrition policy. Dr. Morris is here for 3 days to consult on PAHO's plan of action for the draft school nutrition policy, which was started in 2012. During her presentation at the opening of the consultation, Dr. Morris outlined the role of the school in implementing the nutrition policy.
There have been developments internationally and regionally. One of the developments that I'll talk to you about is the PAHO Plan of Action for the Prevention of Obesity in Children and Adolescents. And that plan of action was developed by the countries, developed by PAHO, accepted by the member countries of PAHO. And the goal of that plan is to halt the rise in obesity in children and adolescents. So there's a recognition that the problem is on the rise. The first thing to do is stop the increase in obesity. And then after we have stopped it, so the first goal is to stop it. Afterwards, we think about reversing the trend.
Dr. Morris described the World Health Organization and PAHO's plan to implement a marketing plan for the food and beverages sold to school children, which will influence their purchasing patterns.
When the children, for example, on a Saturday morning, when they are home and they are placed in front of that television, what are the ads that are coming at them? What are the types of billboards which we allow to be placed at the school, or near the school rather, so that as the child steps out of school, are they faced with a billboard that's promoting fried chicken or soda or something else that may not be good for them? So these are things that we need to take into account in our policies. When the school has sports day, who sponsors it? You know, what are the banners that are placed up there? So that's a component of the policy as well.
Dr. Morris commended Dominica as one of the islands leading the Caribbean on the implementation of a fiscal food policy.
I'm referring to the tax on sugar-sweetened beverages that I believe has been put into force here. I know it is planned that there will be such a tax. Barbados is the only other country that I think has passed a law on that as well. So those two countries, Dominica and Barbados, are leading the way in the Caribbean on that.
The PAHO Nutrition Advisor conveyed that labeling regulations in the Caribbean space for physical activities at schools and safety concerns need to be addressed. She encourages participants to make use of social media to disseminate the information when the school nutrition policy is completed. The consultation on the draft school nutrition policy for Dominica began on Wednesday and ends on Friday. Senior Environmental Health Officer in the Ministry of Environment, Sylvester Senville, revealed that changes in temperatures from climate change increases the risks of diseases and vulnerability to food security in the Caribbean. Senville presented these findings at the Caribbean Regional Climate Outlook Forum, CARICOF, at the Fortune Hotel on Monday. The environmental health officer stated that predictions of increased wet days and temperatures and the elevated intensity and frequency of droughts predisposes countries to vector-borne diseases. He stated that the Environmental Health Department has found a relationship between the increased cases of dengue and increased rainfall.
During the months of June to December, we found there's an increase in dengue, and that is normally a wet season. So we found an increase in dengue at that time. Chikungunya, for example, we found that there's an increase in chikungunya following the 2013 Christmas in trough. So after the Christmas in trough, there was a rapid increase in the number of chikungunya cases in Dominica as a result of the increase in mosquito indices, in the Aedes aegypti indices. This is a chart which shows the household index. This is a percentage of the number of households that are found breeding mosquitoes in Dominica, and over the past, from 2015 to 2014, we found an increase.
Senville stated that the study also discovered an increase in the risk of foodborne and waterborne diseases with increases in temperature.
Gastroenteritis in Dominica is related to both the dry periods and wet periods. But the period of time between the climate events and gas generation differs for rainfall and for dry periods. Climate change increases the risk of food and waterborne diseases. The factors, climatic conditions combined with socioeconomic factors increasing the population's risk to exposure of contaminated food and water sources. Even during the health group this morning, some of these areas came up for discussion. Leptospirosis risk, gastroenteritis associated with ambient temperature and rainfall. Higher ambient temperature can increase pathogen replication rate of foodborne disease. In Dominica, extreme dry conditions are associated with a significant short-term increase in gastroenteritis in the children under 5.
Meanwhile, a case study after Tropical Storm Erica revealed that food security is also threatened by extreme climatic events.
These were the factors that were found to be really affecting food security in Dominica. For example, in 2010, the losses of agriculture to the agricultural sector, 18.28% of GDP, that is 2010 dropped, 27% of employment, 23,000 hectares of agricultural lands lost, 43% reduction in banana exports in the first 11 weeks of 2010, and 160 fires for the first quarter of 2010. Coastal fisheries, higher vulnerability to changing temperature regimes, impacting on ecology and survival of fish species. Coral colonies vulnerable to mass bleaching due to temperature increases. Tropical storms and hurricanes that destroy fish habitat, fishing vessels and beyond.
The most recent display of climate change on Dominica was Tropical Storm Erica, which resulted in over $1 billion in infrastructural damage, 11 deaths, over 20 missing, and over 500 homeless. The study concluded that Dominica can increase resilience to health issues related to climate change by taking adaptive actions to lessen future impacts. You're watching National Focus. More when we return.
I had a bleeding disorder that I did not know about, and they had to be transfusing me continuously. I got 56 units.
Being there at the blood bank, I was like, yo, I'm actually saving someone's life.
You never know when you can go.
Give blood. I have done it, and believe it or not, it don't hurt.
I won't be scared. I'll give. You know you're gonna give blood. I'll make sure she does.
Sit down at the blood bank in a comfortable environment for 45 minutes.
Helping people.
You are stimulating your body to make brand new cells.
You get free cookies, you get juice.
Glad to know your blood group. Feels good.
I felt as a better person.
It's a good thing to be alive, and I can thank God that I'm there and I'm enjoying life.
Welcome back. The Office of Disaster Management is determined to reach out to the general public for this hurricane season. In its quest to ensure that the information is effectively disseminated, a week of activities dubbed Hurricane Preparedness Week is currently ongoing. The activities began with a church service on Sunday, encouraging all churches to pray for a safe hurricane season. In an interview with GIS News, Disaster Risk Management Specialist Cecil Shillingford gave some details about these activities.
The reason for the Hurricane Preparedness Week was really to bring out to the general public the message of preparedness, preparing yourself for the season. And as such, we are having radio talks on all of the radio stations. We've already had one on Q and one on Kyrie. Tomorrow we'll be on the national radio station, DBS, and also Voice of Life, and on Friday on Vibes Radio. Tomorrow afternoon, we have a session with the Newtown and environs. I have already done some training with the Southern District in shelter management and initial damage assessment.
Shillingford stated that next week, damage assessments and needs analysis will be carried out.
Next week, we are going to, Monday, Tuesday, Wednesday, we are going to do damage assessment and needs analysis. And these are some of the key subject matters in disaster. The first things you would have to look at And then as time goes on, we're going to do some training in emergency operations center management. So we are really looking at the areas, the weak areas, and the areas you really have to deal with first. So it's more the preparation and the response, and then later we'll talk about recovery and what have you, but that's a later stage in the whole cycle.
He said the hurricane shelters are ready and the lists will be published.
We have the shelters list, and it gets less and less. When I was first here, it was like 400. Now it's down to just a little over 100, and I'm hoping the reason is because we are building better homes. And again, there's another thing we would like to say to the general public. In your building, if you're building a new construction, it's always good to outfit it with at least one strong room. So if the rest of the house goes, but at least you have one strong room where you can have yourself and your family in during a storm. Because, I mean, we tell people to go to shelters because some of them really do not have anywhere else to go, but the shelters are not necessarily the nicest place to be, I mean, because you've lost your privacy, you may be among people you would not normally be with, and so on. So you can also, if you're building a two-story building, your basement can be your strong room, your shelter.
In related news, meteorologist Marshall Alexander said this hurricane season is more active than that of last year. He gave the predictions for the 2016 hurricane season.
The National Oceanic and Atmospheric Administration is predicting a near-normal hurricane season. But there is a 45% chance of a near-normal season, a 30% chance of an above-normal season, and a 25% chance of a below-normal season. And the forecast is that there is a 70% chance that there is expected to be 10 to 16 named storms, 4 to 8 hurricanes, and in those 4 to 8 hurricanes, 1 to 4 is expected to be major hurricanes of category 3, 4, or 5, with winds of 111 miles per hour and greater. We are expected to be more on guard this season because we are entering this hurricane season in a vulnerable state because we are left with the impact of Tropical Storm Erika last year. So even more reason that citizens should be aware and take all the necessary precautions.
Marshall noted that the Meteorological Office is prepared for this hurricane season and encouraged people living in low-lying areas which are prone to flooding to always listen for updated weather reports.
We are always prepared. We always putting out information. We continue to monitor the development of systems, even from the coast of Africa as it comes across the Atlantic to our area, and we continue to put out information to the public. But the onus is on the public to take this information and to always pay attention, listen to the weather report, and to follow the guidelines. Because we know that if we're expecting a lot of rain and you're living in an area like close to a river, and we expect the river to, with a lot of rain, we expect that the river would overflow its banks, then it would be on you to move.
And that's the English news. Your tip of the day is next. Crime prevention tips brought to you by Crime Stoppers Dominica on personal safety. Be careful of strangers who approach you soliciting favors. When you walk, ensure that you carry your purse towards your front. While walking, stay close to buildings and areas that are well lit. Avoid shortcuts. Walk confidently and at a steady pace. Rapists look for someone who appears vulnerable. Avoid bushes and alleys where rapists can hide. That's all for this edition of National Focus. We always welcome your suggestions and comments. Drop us an email at gis@dominica.gov.dm or visit our website news.gov.dm. Like our Facebook page, facebook.com/GIS News Dominica, and follow our Twitter at GIS Dominica. You can also catch up on past National Focus newscasts on our GIS Dominica YouTube channel. Live streaming is now available also on our YouTube channel 24 hours a day. From all of us here on the GIS News production team, I'm Shaakira Pierre. Thanks for watching and join us again next time on National Focus.